Hey everybody, welcome back to the J Gray channel. So it's been like what, a little over 3.5 months since I had the teeth put onto my implants here. So I thought I would do an update for everybody. So, just kind of do a little catch up, see what's going on. Yeah, I was outside in winter in Minnesota, so my hair's a little crazy. I know. But anyway, it's been going good. For a while, right after I got the implants on, it seemed like every implant started to get like a couple of them I was getting like some pain out of, and I thought that was a little odd. But somebody else had told me that they when they first started using their teeth, they started getting like feels like a soreness deep inside their implant there, like feels deeper. And I think it's just from getting to use it. I think it may be normal. I can't tell you for sure if it is or it isn't for you or not, but it took a little while and it went back to normal. I think it was just starting to get used to eating things and some harder things, and so other than that, I've been doing pretty good. As far as the eating thing goes, I've been able to eat pretty much everything. There's just it's been going pretty well. Like I said, I was having some soreness, some tender spots up, especially a couple of these. It seems like one over here would bother me, and this was like right after I got them put on. I started using them. So as soon as I would start chewing or whatever, I would feel like a pain up in there, and I start. So you do it. You try to put it over to the other side or not bite as hard. I'm not sure if I was just kind of over biting or if I was, or if it was just, normal, because they put the implants in and I ate over them because they were healing under the gum. Then they put then they expose them, put the abutments on there, and then they put the teeth on top. And then that's the first time, because it's the first time I really put pressure on them, and they were kind of sensitive for a while, so. I don't know if anybody else had issues like that, but it was different. So I wanted to just kind of touch base about that for just a little bit and leave it at that. Other than that, like I said, I've been eating, going out doing things. Today was pretty cool, pretty cool. I'm at a big box store, right? So. I'm cruising the aisles, I go there to get, because now I can eat like beef jerky and stuff, so I can get that in mass amounts, So I go there, and pistachios and stuff, So I go there and I'm just kind of looking around, and I see they had a water pick, and I already have one. I already have a water pick, but I stopped. I took a look at the water picks, and it's kind of like they got like a dental aisle, and everything there is in bulk. You know what I mean? So I'm sitting there and I'm looking at stuff, and a girl comes up to me and she just looks at me, and she's kind of, I can see that her and her, I think it was, I'm going to guess her mom and possibly her sister or friend or whatever. And the girl, I don't know, she was probably mid-20s, maybe late 20s, but anyway, I'm just slowly walking down the aisle, and finally one of the girls comes up to me and she says, "Excuse me, but my friend doesn't have the guts to ask you, but do you do anything special to your teeth? Have you had, do you have veneers? Like, you have really nice teeth. They're like so straight." And so, and I was like, well, I was kind of like, because they're sitting there. I mean, I'm not a real tall guy. I'm like 6 feet tall. So, but the height of her, she's just looking right at my teeth, and I was like, and I was like, thanks, sure, It's funny because I had one guy going at a party once. I was just messing with him. I told him later on, but he asked me, he's like, "Man, you got like your teeth are like really white." He says, "Man, you must have gotten whitened since I seen you last, because I just don't remember seeing your teeth like that white." And they're PW2, so they're not like. They're realistic look. I mean, they look good. They look really good out in the daylight. Like, they look really, like they are the closest thing to about as white natural as you can get. Anything beyond that is like, PW4, PW7, and we're talking like considerably whiter. So, but I was at a party once, and I said to somebody, I went and met up with some old buddies, at a bar, he's like, man, it's been a long time, but your teeth, I just don't remember them being super, super white. You had to have gotten them whitened or something, and I'm just kind of laughing. I was like, actually, I've been, I soak them in goat milk and, goat milk for 21 days and stuff like that. It was kind of funny. Hold on a second. Fooey Dad! You want to see my dog has gotten into something. What do you got there, buddy? What do you got there? Yeah, guys, oh, you stole a pistachio. He loves these little suckers, so alright, I'm just gonna... Oh, that one's in there. There you go. That's Jed. Bincy Boo. Hi, Bincy Boo. Say hi, Bincy Boo. Archie Ball. He's almost time for a haircut. Archie Ball. Hello, buddy. Alright. Sorry. I had to check and see what he had. But, now he's looking at me. So, basically, and I tell him later, I'm just kidding, most people, I have some family members that just have huge, big mouths. So, most people that I know I had dental implants or had issues or had teeth replaced. For the most part, just, people, some people have asked if I had work done. And I say, yeah, but can you tell which ones? And it's funny because, I shouldn't say funny, but when people try to look, they try to discriminate which tooth is it, which one. And they don't realize that it may be all, I mean, when my teeth are out in like natural light, because right here, I'm looking in this, they look kind of yellow to me. And they look really, and I don't know if it's because the color of the lamp here, because the shade's kind of got a little tint to it. But in the light, my teeth look really nice, really, really beautiful. Especially when the light hits them because they're PW, portrait white, which means your teeth have a slight indent to reflect the light back. They look really nice. So I haven't any complaints about that at all. So I see if I can get close to a natural light to give you some sort of an idea. Bob's kind of look a little yellow. My teeth are really nice white. They really are. They look great. So, anyway, as far as being 3.5 months doing this, it's been awesome. It has. I love it. These things are great. I feel like it's restored. Even like I can feel now. I'm starting to get to the point where I can tell when something's on my tooth. I can tell hotness. I can tell cold. I can tell all those things. It really feels really, really close to a restoration. It really does. And, I mean, the words can't even explain my gratitude. How, this guy, the dentist who did it, he really did good. He did. And he really gave me my life back. He really did. So I'm more than happy. I mean, if anybody wants, he is a dentist. He's a surgeon dentist, I guess you'd call him. He's a specialty, and he's going to be working in Canada towards the Lake Victoria area. So if you're in Victoria area, Canada, by British Columbia, you can get hooked up. He is so good. He listens so well. It's I live in the United States, but he's a dental student right now, and so he had finished dental school, and he did a 3-year specialty in surgery to become a surgeon, and that's when I met him, and I basically have known him all through his college career, and he is. Him and probably I've seen another guy over there who had really beautiful work too. And it's funny because one of the other dentists told me how lucky I was to have this my particular doctor. Now I didn't ask him, so I'm not going to use his name. But if you want to know it and you want to look him up yourself, you can leave me a message if you're if you're looking for a like a really great dentist that really listens, because I have a feeling he's going to be like one of these very well known ones, because he does very, very flawless work that looks very natural. So um, as far as doing more videos, I've been putting these videos up of my surgeries and things like that. This is what people ask me for. You guys asked for it. You guys said, I said, I threw it out there once, and people were like, yeah, I'd love to see it, And guys, leave a comment, ask some questions. This is what I'm here for. I'm offering to do this to help you, because I didn't have very many people around to help me who went through the process. There's no dumb questions. Just ask, talk. If you want to just say hi, you want to talk teeth, you just need somebody to talk to who's been through it before. That's what I'm here for, all right? So I hope to hear from all of you. It doesn't matter, male, female, 20s, 80s, 90s, it doesn't matter. Say hi, all right? That's what I'm doing this for. I'm doing it for you. I want to help you guys, all right? So, again, it's over 3.5 months. I'm starting to actually get a smile back. Kinda, sorta. So, anyway, thanks. Thanks for watching. Like, comment, whatever. I'll talk to you later.